Bola Labinjo, and I want to discuss briefly about the health benefits of fasting, especially Ramadan fasting. During fasting, I enjoin to fast every year during the month of Ramadan by the Almighty Allah subhanahu wa ta'ala in the Holy Quran. And there are certain conditions that are supposed to also be present, or we need to practice with our fasting. And some of these result in its psychological and emotional stability for us. You are meant to be well-behaved, calm, patient during Ramadan, slow to anger or not to be angry at all, as much as possible. So if you really are fasting and you are observing these attributes, these conditions, it is very likely that you are more psychologically and emotionally stable. And this, of course, has an effect on the function of your body system. So it's not unusual to find people that are usually hypertensive and find that the blood pressure behaves better during the month of Ramadan because there is less road rage, anger, domestic violence, and stuff during the month of Ramadan. Perhaps the commonest benefit that everybody tends to see with fasting, even those who are not fasting as Muslims, is obesity. People use fasting to lose weight. That shouldn't really be the essence of Ramadan fasting. But since it's something that happens and it's very well known, that if you don't eat for certain periods in the day, you are likely to lose weight. Here we have to distinguish between starvation and fasting. Whereas starvation has negative impacts, fasting is positive. Because when we eat, the food goes into the system. A lot of our food is converted into glucose at the end of the day to provide fuel for the body to function. And this is used up and part is stored, converted and stored. But when we fast and we don't eat for a period of the day, because we are breathing, we are walking, we are active, we need fuel to do this. So there comes a time when the food we are eating at Sahur has completely left the system. And then your body has a mechanism that will now convert fat that has been stored in your body and convert it to glucose to be able to provide fuel for us to function. So when this happens continuously over a period of time, the fat is depleted. And then, of course, it results in weight loss. And this is how it's beneficial to those who are obese. The other demonstrated or established fact is that there is increased insulin sensitivity when you are fasting. So that the amount, even for those who have type 2 diabetes, the amount of insulin they produce, which hitherto wasn't giving them a particular level of effectiveness in converting their insulin into storage, is now better because they have a better control of the blood sugar. That's a very, very important fact for those who are on anti-diabetic medication. You might find that during fasting, they might even have to reduce some of the dosage of the drugs that they are using, either to be able to achieve the same effect. Your digestive system is also impacted because as it slows down generally. So when there is slowdown of digestion, there is improved metabolism on the whole, improved absorption. So, and the bowel movement is also improved. This is also beneficial for everybody. Now, during fasting period, the blood sugar is reduced. We also find that blood pressure is reduced. We find that cholesterol level is reduced. Even the inflammatory markers are also reduced. So all this impact positively the health of our hearts, And then, of course, there's a reduced risk of or intensity of arthritis and asthma. So you find patients who have these conditions, they observe an improvement in their overall health status. And there's another aspect of it which has to do with the immune system. That's the cellular repair and the removal of waste from the system. When you fast, you get rid of some unstable molecules, which we call free radicals in the body. And when you get rid of that, because the intestine is free, some of the dead cells or weaker cells are destroyed and excreted by the body itself. So the cells which remain, survival of the fittest, the ones which remain are actually healthy. So, and that improves the immune system, and you are more immune, and you are stronger to face and fight other minor infections and some other conditions. This removal of free radicals also helps to reduce the risk of cancer. And also, because the blood sugar is lowered, you also starve cancer cells. So in actual fact, patients have been known to get a better result with chemotherapy, because in addition to the drugs they are taking, there is also the starvation to the cancer cells, which is also good. So this cellular repair also, this same process of clearing dead cells and they will remove free radicals, also help the brain in terms of the brain function. So you find that people who fast are at a less risk of developing Alzheimer's and Parkinson's and so on. So this is even the benefit beyond the 1 month in a year. People actually are known to fast periodically in order to be able to take advantage of these beneficial effects. So the people who are on treatment, generally, who are on treatment for chronic conditions like hypertension, like diabetes, like ulcer, are advised, of course, to consult their doctor before they start fasting. This is because there might be a need for them to adjust their medications. The drug you are using 3 times a day could be tweaked to be 2 times a day. The dosage might be lowered so that because already fasting will give you some benefits and give you some advantage in terms of controlling some of these conditions. So it is important that you speak with your doctor who might want to adjust the medication that you are using. The fact of the matter is that you actually get more benefits for the price of one when you fast. Apart from the spiritual satisfaction or fulfillment or spiritual obligation, you also find that your health condition is generally enhanced. So we should have enough of all these. I can't fast because I'm an ulcer patient. I can't fast because I take drugs 4 times a day. The truth is that, to start with, who diagnosed your ulcer? And besides, it is also very possible for an ulcer patient to fast and fast correctly, but you need to be guided and see your doctor before you fast. Assalamu alaikum wa rahmatullahi wa barakatuh.